Starting with the bioavailability. So let's start with the definition first. So it is the fraction of drug that reaches the systemic circulation unchanged. So let's write it down. Fraction of drug that reaches the systemic circulation unchanged. Cis- Circulation unchanged, right? So so you can appreciate from this definition that if bioavailability is high, then the drug is needed in low dose, right? Because for a drug to act in a systemic circulation or in body for any function, it need to reaches in systemic circulation. So let's write it down. Dose. V implies low dose. It's quite evident that if any drug has low bioavailability, if it works in very low dose, it depends upon several factors, just like absorption and first pass metabolism. So I'll talk to it one by one. Number one factors. Number one is absorption. So if a drug is absorbed more, that implies that the drug has high bioavailability. So bioavailability has proportional relation to absorption. So let's write it down. If absorption is high, that implies increased bioavailability, and vice versa. That implies decreased bioavailability. So it has got proportional relation. I'm not writing it. Just write it in your notes. Then comes first pass metabolism. I'll try to explain it right, as far as I can. Let's write it down. First pass met. So this is a phenomena in which any drug or any fraction of the drug lost during its when it reaches the systemic circulation by liver or wall of GIT and all. Just write it down. Not, I don't think it's needed to write it down. So I think you know. So what does it imply? It implies that if first pass metabolism is high, so that drug is low bioavailability, and vice versa. That if first pass metabolism is low, that drug is highly bioavailable because that loss is very less if it's high. If matlab, if first metabolism is high, then the loss of the drug is very high. That means low bioavailability. So that means inverse proportional. So let's write it down. Okay. So there is a graph. Just see it. Okay. So if any drug is given in systemic circulation or IV that reaches the blood vessel directly, so it has very less, almost there's a negligible amount of first pass metabolism. When there is any drug which is given in oral route that have to reach stomach, liver, and several organs, so there is a high first pass metabolism. So I think you can appreciate from this graph that It has very high loading dose in case of IV, and oral you can appreciate, right? So there is a thing. Uh, this is the area under the curve of if it is given in oral route, and this is the area if it is given in IV route. So from here we can conclude to a formula that bioavailability F denoted by F is equals to area under the curve if orally given, and area under the curve if given in IV dose into 100. You can use this formula to solve several numericals. If you want, I can help you to solve. Let me know in the comment section if you needed any kind of such numericals. I'll surely do it. So we can write one more line also, that so bioavailability is maximum in IV route. So that's it for this video. So I have almost covered maximum points of bioavailability. If I have left something, so let me know in the comment section. I'll surely let you know if any doubt has been left. Okay, bye. Thank you.